Good morning, East Africa. My name is Gladys Gachanja, coming to you from Nairobi in Kenya, and this is your world #New Normal. Now, the novel coronavirus pandemic has heightened the vulnerability of children, with various factors putting their rights at risk. Today, we take stock of the welfare of our children, and we shall be speaking to different stakeholders who are involved in child protection. Now, as usual, remember, you can join in on the conversation through WhatsApp or calling or using that #New Normal on any of the social media platforms. Here now is what you can expect on your world this Wednesday. Today, we highlight another vulnerable group that needs protection: children, and especially the girl child. As we focus on children's rights, Governor Kingi gives a home to newborn quadruplets who were rendered homeless by the floods. Portraits of nurses, doctors, and other essential workers are being projected in front of the Eiffel Tower in Paris in a tribute to those facing additional risks during the coronavirus pandemic. And if you're Now, being a girl in a male-dominated community, one has to rise up and find their place, even if it means you rise up and dance to some reggae. Thank you for joining us. Now, our question of the day, even as we focus on child protection, is what are you doing in your community to protect or safeguard the children? What are you doing in your community to safeguard our children? As you know, they are with us. Now the schools were closed. What does that mean in your community, and what are you doing to safeguard their rights? Well, remember again, #New Normal, and you can reach us on that WhatsApp number, and you can also call in with your comments and of course your questions even as we go on with our conversation this morning. Now, we're talking about the disruption of COVID-19. Let's look at the effects of the same, looking at the numbers globally, starting off with the fact that globally 4,342,354 people have been confirmed to be positive of the virus. 1,602,443 are recovered of the virus, and unfortunately 292,893 have succumbed to this virus. Now, here in Kenya, 33,916 Kenyans have been tested so far since the mass testing started, and 715 this far have been confirmed positive. Unfortunately, we have lost 36 Kenyans to this disease, and 259 have recovered of COVID-19. And now, when we look at the continent, remember 54 countries each affected in one way or another, and Tanzania, the cases there, confirmed cases 509, deaths unfortunately are 21, recovered cases 183. Ethiopia, confirmed cases 250 people, deaths are 5, and recovered cases 105. We have Somalia, who are at 1,089 cases confirmed in that country. Unfortunately, 52 people have succumbed to the same and recovered 121. South Sudan, confirmed cases 156, deaths none so far, and recovered 2 people. Uganda, cases 122, deaths none also, and recovered people are at 55. I look at Rwanda, the confirmed cases in that country 285, no deaths this far, and recovered cases in that country 150. Now, Burundi, confirmed cases are at 15. Unfortunately, 1 person has succumbed to COVID-19, and the recovered cases stand at 7. That is a look at how COVID has affected the global scene and, of course, right here in the continent and closer home in Kenya. We'll keep you updated on the same. Now, concerns have been raised about the possible transmission of COVID-19 through various items, including newspapers. Now, the Nation Media Group has moved to affirm the public that they can interact with their dailies and not get infected. Now, this is partly as a result of the strict measures that are adhered to in the entire process, from ensuring personal hygiene among the staff, sanitization of equipment, and all the other points of contact between the printing plant to your hands.
My name is Jamlik Kuria, Dispatch and Logistics Manager, Nation Media. When people are coming to work, at the entrance point, we start by ensuring that each and every person has to wash their hands with soap at the entrance point. The second step is that everybody coming in is tested on his or her temperature to ensure that they have the required temperatures. Since they come with their personal masks, they are exchanged and they are given fresh masks before they enter to their workstations. And we make sure that each and every person sanitizes before they also wear their gears to enter into their workplaces. We ensure that when they enter into their workstation at the mailroom, every person has to keep distance from each other, recommended distance, even when they are working and they are doing all their activities. We ensure that because several processes are automated, people only come into contact with the copies where necessary, and we make sure that anybody who is handling the copies handle them in a procedural manner. At the point of counting, we make sure that these guys or these counters use the recommended counting procedures. The copies are then packed and handed over to the delivery teams, our drivers, who again receive the copies from the mailroom team and make sure that, following the same procedures of sanitization, they handle the copies carefully and put them into the vehicle. But before they put the copies in the vehicle, we have the process of ensuring that our vehicles are disinfected properly immediately they get into the workstation. The first step is that we have the pump, which is used to spray all the vehicles at the point at a common point, so that each and every vehicle is assured of being free of any infection or any virus infection. At that point, the vehicles are driven to the loading bay, whereby the drivers do loading, and once they load the copies, they make sure that they sanitize themselves. At the point of delivery, when the drivers are delivering the copies, they make sure that when they are handing the copies, they make sure that the person they are handing to is also sanitized, and therefore we are assured our process is foolproof, and we are confident that our copies cannot spread coronavirus in any way.
There you go, a reassurance that you can actually pick up your daily nation and it is safe for your consumption. Now, the COVID-19 pandemic has hit the creative industry, and their 100 million shilling problem is seated at the Ministry of Sports, Culture and Heritage door. Now, the Kenya Association of Music Producers, the Performers' Rights Society of Kenya and the Music Copyright Society of Kenya have decried the government's distribution plan for their 100 million shillings for artists. The societies say they are the main bodies which represent artists and have been left out in the planning of the stimulus program.
Considering our mandate and membership, the CMOs are integral and have a fundamental role in facilitating the President's program herein in liaison with the Ministry of Sports, Culture and Heritage. In conclusion, therefore, as CMOs, we feel to be the best placed institution through which this well-intentioned stimulus project aimed at assisting Kenyan artists should be implemented.
Now, elsewhere, Namanga residents are demanding the immediate closure of the border over fears of COVID-19 spread by truck drivers waiting for clearance at the busy crossing section. Now, a section of truck drivers from Tanzania have raised concerns over the testing process by Kenyan authorities. NTV Seth Tolale with that report.
36-year-old Francis Mkane, a Tanzanian truck driver who ferries motor vehicle tires from Dar es Salaam to Nairobi, is among 126 cross-border transporters at the Namanga one-stop border crossing who tested negative for COVID-19. However, 5 of his colleagues tested positive and were sent back to their country on Monday. 9 Kenyans also contracted the virus here in Namanga and are currently getting medical care at Kenyatta University Referral Hospital. Of significant concern to Mkane and 126 drivers who have been camping here is the procedure for testing COVID-19 by port health workers.
Madereva wengi wanachukua muda mrefu kuweza kuishi hapa. Sasa wanaishi hapa vipi? Kwa sababu kwa asilimia kubwa wanaishi guest. Je, guest kuko salama? Hakupo salama. Kwa kuna hatihati kubwa kwanza ya ugonjwa kuweza kutambaa zaidi kwa kuwa bado tunaendelea kutumia mazingira si mazingira salama ambayo tunayaishi.
Tanzanians who have been tested across the border and come with a COVID negative certificate, we will allow them to proceed, but we'll also be able to pick our own sample, take their details, run our own test and be able to verify that.
Hata wale wanaotupima pia wawe makini na hiyo kitu kwa sababu hawezi kunipima mimi wakati huo amenipima mimi ametumia mkasi ule mmoja kukatia ile kipimo yangu, bado haja sanitize ule mkasi wala ye mwenyewe hajapaka sanitizer mikononi, anakuja kumshika mwingine anampima. Hilo nalo bado ni changamoto.
And remember, Kenya, Ethiopia were some of the first frontline countries to be trained on testing for COVID-19. We are super confident about our results. Our laboratories have been validated by the World Health Organization, Africa CDC, US CDC, and we are confident of the results we issue.
Lawrence Okello is another truck driver who transports gas from Tanga to Nairobi. He says they have been forced to incur extra costs for spending additional days at the border point.
Ukionekana wewe ni dereva unashukiwa hata ukienda ile sehemu ya kulala. Ile sehemu tunakoenda kulala unakuta pengine haujui ni nani aliyokolala pale, kama alikuwa kupata maambukizi ama wewe mwenyewe haujulikani kama ndio una maambukizi. Unaenda pale unalala, asubuhi unaamka sababu hauruhusiwi kulala kwenye gari.
Namanga residents now want the border shut. They say unrestricted interaction of drivers with locals will increase the number of infections at the busy crossing point.
Sababu hata hii yetu ni hatari kwa sababu kuna watu wanapitia kichochoro, wengine wanapitia nyuma ya mlima na wengine wanaingia kwa njia ya mikato. Kwa hivyo kuna hapa ndio itakuwa zaidi hata isili.
We will not close for goods and services, right? Because we must keep the economy running.
Health authorities now say they will roll out mass testing for all residents in the area through a mobile lab. Of all the 5 Kenya-Tanzania border crossings that include Lungalunga, Namanga, Oloitoktok and Sirare, Namanga is the busiest, having a record 1,300 crossings in a particular day. Now, port authorities are going to replicate the exercise being done here to other border crossings. Seth Olale, NTV, Namanga, Kajiado County.
Now, even as we focus on our conversation of the day on your world, Kenya was among the first African countries to ratify the Convention of the Rights of Children, which is abbreviated as CRC. Now, this was a bold public declaration to protect all rights of all children. Since then, we have seen great advances in child rights in this country, and we'll be mentioning some of them even as we continue with the discussion. And the convention is the most widely ratified human rights treaty in history. It has inspired changes in all parts of the world, including incorporating children's rights principles into legislation, establishing interdepartmental and multidisciplinary bodies to address children's rights, developing national agendas for children, addressing discrimination and other barriers to the realization of child rights, including social, economic disparities among children, creating opportunities for children to express their views and be heard, just to mention a few. And on the same, 28 young women were rescued from a hideout in Penyanya area in Dandora. Now, the women are believed to have been on a mission to travel to Saudi Arabia for domestic jobs. Now, the women were being held against their will with promises from their agent to get them to Saudi Arabia. Police officers received a tip-off from members of the public who were suspicious of the activities being carried out in that house. One of the women say they had been locked in the house for weeks, and police are now looking for the agent identified as a FARC as investigations are ongoing.
Nimediscover kwanza kuona mateso nikiwa Kenya hii. Je, nikienda Saudia nitateseka kiasi gani? Kama kufungiwa ndani ya utoki, mnaambiwa mko na choo na bafu. Sasa mnaenda kutafuta nini nje?
And on that point, we kick off our conversation today, and we are focusing on child protection and, of course, their rights, even as we go through this COVID-19 pandemic. To help me have that conversation in studio, I have Nancy Okoth, who is a project manager for Girls Advocacy Alliance at Plan International. Thank you for joining me. We also are joined by Martha Sunda, who is the executive director, Childline Kenya. That is a helpline 116 that goes out to ensure that you can report any cases of children who are being mistreated or abused. And Martha will be giving us more details on the same. She is in our newsroom. And we are also joined from Lodwar by Terry Maloba, who is a senior women protection and empowerment officer, International Rescue Committee, again from Turkana County. And we are also joined virtually by Kennedy Odede, who is the founder and CEO Shofco, which means Shining Hope for Communities, and I'm sure anyone who's heard of Shofco knows exactly what they do, but he will elaborate exactly what they do in as far as child protection is concerned. Everybody, thank you for your time. I'll start right here, Nancy Okoth. Even as we're talking about child protection, that story about the girls being held against their will in Dandora is one of the examples we can start with, right? And in such cases, we have had of children's rights being violated by them being forced to do things they don't want to do. For example, being taken to other countries for work, which means child labor. What does that mean, and how has that become something that is going up in the season?
Okay, speaking about the season of the pandemic of the COVID, I think even earlier on children has been an easy target for everyone, as in getting into children has always been so easy, especially where child poverty is, child-aided households, the children that are always maybe the adolescent girls that have given birth. So getting into them has always been so easy. So again, now during pandemic, things have not gone very right. The economy has gone down. So it means that now enticing these children, making these children to get into some other activities that they are not supposed to get into, has been now, so they become more gullible. So they're easily enticed into getting into other activities, somebody enticing you with a job, just like a case that you've talked about that is in Dandora. So it has been so easy, and right now they're getting into issues of commercial sex work, children are easily getting into child marriages. And then for that, most of them are even getting into early pregnancies. Yes.
Okay, let me bring in Kennedy Odede, and I will refer to some of the articles within the child ratification, or rather the Convention of the Children's Act. And one of them is the fact that children should be protected from work, and they should not work if they are under the age of 18. Working in the informal sector for you, or the settlements for you, Kennedy, how does that look like in this season of COVID-19?
Thank you so much, Gladys. And right now we have this pandemic, and it's been really affecting the entire community. And as you know very well, that the children who are in vulnerable places like slums are really getting so much affected. So right now, to be honest with you, there is no fear of child labor. Why? As we work around the community, there's no jobs in the community, so people are jobless. But I'm just worried that, as you're saying, that even when things are okay in the country, children are the most vulnerable in the society. And therefore, they have been affected a lot. So right now, what I've seen in the communities, actually in the slums, we are seeing a lot of cases of child abuse. How's this coming up? I think now they're doing a lot of domestic work, even too much. And it's a common sense. If you are a parent who is very poor and you have no food to eat in the house, you end up becoming very angry to your child. I saw that when I was growing up in Kibera. You get all those things. So I think right now, as my fellow speaker talk about it, we have to be very, very careful and out there, because I've seen our gender-based violence place. We have seen the high cases of abused children is really getting high. Again, at this moment, what is a child? A child for me is, according to the Kenyan law, is anybody below the age of 18. So what does that look like for the girl child in these slums? It's so terrible. Right now, people are trading their body for food, these children. So we have to be really look out for these children now. You know what I mean? We have to make phone calls, otherwise, and we have to work with the chief local administration, because life is hard, and there is right now people are just so worried about basic needs. You know what I mean? And I'm also asking people who are giving food and all those kind of things. We have to make sure also that we take care of the children in these communities, because they are going through a lot, and they don't have much voice as other people. So so that's what I can say in terms of what's happening now to our children and with this pandemic. And I'm sure if we can just come together and just put our ears out there, we can try to prevent a lot of abuses.
Let me bring in Martha Sunda, who is in our other studio here at Nation Center. You are the Executive Director at the Childline Kenya. Have we seen the number of calls coming to you in as far as probably child labor and other forms of abuse?
Yes. We have been receiving a lot more calls than before, and a good number of these calls are about child abuse. So we have girls who are married off. We have children who, while at home, are being subjected to labor, or they're being given off to neighbors or farms to go work, because now they're not in school. So some families feel like they should be assisting to put food on the table, so they go into child labor. We have children who are in situations where they are forced to engage in prostitution to raise some money for survival, really. So it's a bad state. We don't look forward to the next call, because you really don't know what is coming through, and it's really traumatizing to see that the child is in a situation where they are forced into things that are demeaning, things that put them in a situation of distress. They're quarantined. Some of them are quarantined with the perpetrators, and so they're in this situation where they're really not able to do anything about it. So they're stuck in here with this person who is abusing them through and through. It's a bad state.
Now, Martha, even as we speak about the helpline 116, give us a tidbit of exactly what happens when somebody calls you?
Great. So when you call 116, you will find a counselor who will listen to you, take down the case, ask you questions that they need to get so that they're able to refer you accordingly or to offer you the service you require. And then after that, because usually the call wouldn't take that long to take the details, there will be follow-up calls. So they will keep in touch with you to check whether you received the service that they referred you to, or just to check that you're well following the intervention that was given. We will also be in touch with the service provider we would have referred you to just confirm that you got there, you got the information you required. And so it's a whole long process until we are sure the child is safe. That's when we consider a case closed.
So when I call 116 today, I'll find somebody at the end of that line?
Yes, you will find somebody at the end of the line.
Thank you, Martha, and I'm sure that is great information for all that are listening and watching us this morning. Sure. Over to Terry Maloba, who is in Lodwar, Turkana County, and you are the Senior Women Protection and Empowerment Officer at the International Rescue Committee. You work directly with women, but also with children. When you talk about child labor, how does that look like in that county?
So I'll start with maybe just a brief introduction of what we do. So we offer gender-based violence prevention and response services at the Turkana, in Turkana County since 2012 in partnership with the county government, specifically the Ministry of Health. We are actually located at the Turkana Wellness Center, which is in Lodwar County Referral Hospital, and we are currently implementing this project under the UNICEF funding. At the moment, we provide psychosocial support, clinical care to sexual assault survivors, as well as empowerment programs, specifically targeting young girls and women, and community awareness raising campaigns. So children and adolescent girls specifically are facing a greater risk of sexual and gender-based violence. And looking at the data of reported cases at the Wellness Center, we find that over 65% of the reported cases involve children. And actually the highest reported case is defilement, whereby majority of the people affected are girls. So we see the impact of COVID-19 to to the issues affecting children. Now, so over to your question on child labor and how it looks like in this place. So the challenges that we are actually facing are that because schools have closed, children from marginalized communities have no access to online learning like their counterparts in urban areas. So you find that most of these schools would provide young girls with pads and all. And now that schools are closed, they are unable to access proper menstrual hygiene management equipment. Hence, we see that women actually, or rather young girls are actually selling their bodies and trading sex for pads and some of those other essential services. And also the economic stress resulting from the pandemic that we are all talking about have really increased the potential on child labor and forcing the children to actually, or rather the adolescents, to look at other negative coping mechanisms to just be able to cope and survive. That means they're turning more to alcohol and drug abuse, and also engaging in premarital sex, which is increasing cases of teen pregnancies. It's interesting how last year at a time like this in April 2020, we had about 20 cases of teen pregnancy, and now it has risen to 127 as reported. So you can see it's not only doubled, more like quadrupled. So yeah, we really need to rise up and do something about this.
And when you talk about rising up and doing something about it, from your county, what do you think can be done in your capacity to help deal with such situations?
what we can do is advocacy, increase our advocacy, because as much as it's important for us to, of course, it's good for us to see how we can be able to prevent issues regarding COVID-19, but also the measures that we put in place have to also put into considerations the impact of these measures, more so to the vulnerable populations, such as children and also women and the elderly, and what it is also doing to them. So what we can do is also continue offering the essential services that we offer, which are the GBV services through mobile support and static support, as well as continue on with our community engagement and sensitization sessions. Yeah, I think that will play a great deal.
Now, before I let you go, stay on the line. There's a question I would like you to actually answer, even as I come back to studio. Nancy, she talked about some of the other issues that come up when it comes to poverty. Sex for sanitary towels. This has been an issue we've been dealing with, but now it seems to be getting even worse with the pandemic.
Mm-hmm. Okay, Gladys, what is coming is that there is economic constraints. Mm-hmm. And with economic constraints, the people now prioritize. What is it that I buy? Do I buy sanitary towels or do I buy food? And then for some parents, it is like, now that you're not going to school, do you need the sanitary towels? You can easily use the clothes. It is about sanitizing. It is about water. And I think me and you know that there's been water shortage in Nairobi most recently. And what does that one mean? Is the parents going to prioritize water for bathing or water for washing hands or water for food? So for me, it is about priorities, and this is what makes the children to become more vulnerable. And even when it comes to issues of learning, because you realize that learning is now online. And then again, when it is an online learning, they need power. The power, it is not for free. They need the gadgets to learn. The gadgets are not for free. So for me, it is about priorities. And with the economic constraint, it is not so easier to prioritize the needs of children and even the needs of girls and young women. Mm-hmm. It is more of, we are only able to get food and maybe a place to stay.
And you bring up very pertinent issues. Terry, the issue of education, making sure that this continues for our children, those who can have taken up e-learning in Lodwar. Is this possible, and what is the county government, and probably in your position, are you doing to ensure we enable our children? Okay, we seem to have lost her connection, but then again, Terry, all right, I hear she is back. Terry, if you heard my question. Okay, let's continue. We have a technical hitch as far as her connection to us is. She was coming to us from Lodwar. Terry Maloba, thank you for joining us. And even as we talk about this, let me bring in Kennedy. Kennedy, the sanitary towels, sex for sanitary towels is something that is very, very rife, especially in the informal settlements, right?
Yes. Yeah, and I think it's because of, it's something that, because people can't afford, you know what I mean? So we have to ensure that we provide that, because it's so sad to see children trading their bodies. That's because of the sanitary towels. So it's something that I call it, for me, it's a basic need, you know what I mean, that we always forgot, you know what I mean? So, and even right now during the pandemic, we should, even as we think of food, as we think of giving people food, water, sanitary towels should be part of it, because that's part, you know, for me, it's a basic need, you know, it's something that we should not forget, and people don't talk about it much, you know what I mean, and therefore you see young girls are trading their body for that, you know, so that's something that's really unacceptable. And I think I know the government has been doing something on that, and something that we should really, really be careful of and always think of. Yeah.
And when we talk about the lack of water, we're talking about wash your hands so that you can keep the COVID-19 at bay. What is the situation like in the informal settlements?
Gladys, so I grew up in Kibera. So truth be told, when I first heard about Corona, I thought the words were mostly for the rich and the West. You know what I mean? What is the social distancing to somebody who live in a congested environment where you have to share a pit latrine with 50 families, as I used to? You know what I mean? So it's really tough, because I can say that for the upper class, middle class, it's okay. You have a fridge, a freezer. You can put some food there and stay for a couple of weeks and not going out. But it's unrealistic to be told in slums, informal settlement, you know what I mean? So the first thing we did was that how do we play that word? First of all, is physical distancing, you know? And we realized that, Gladys, what people need first is basic need. So we started doing what? Putting hand washing station. Right now we have over 400 around the country, so bigger ones. And then we start bringing water tanks to your door, so you can get water and then giving food. Then now we can start talking of, you know, there is water here. The importance of, if you talk about places like Kibera, Madare, or the slums, the community love each other. Believe me, they love their neighbor. I remember I used to borrow sugar, salt from my next neighbor. There's no way I'll have a disease that will kill my neighbor. So if they know that, now I believe that community taking charge. And that is right now, to be told, I'm so sad. I don't see enough people in the slum owning Corona and being like, this thing is real. You know what I mean?
Okay, Kennedy, let me stop you a little bit on that. We shall be delving into that and, of course, the myths that come with the same. Let's cross over to Lodwar, where Terry is still standing by. And Terry, we've talked about sex for sanitary towels, FGM, and also just the lack of the basic water that we're being told to wash our hands with to keep COVID-19 at bay. What's the situation like in Turkana?
Sorry, kindly repeat the question again.
We're talking about FGM, we're talking about sex for sanitary towels, the lack of water. What's the situation like in Turkana?
As I have explained, the situation in Turkana is Turkana County, specifically Lodwar, is that, as I have said, we have issues with accessing adequate water, although we are trying to make water available for people to be able to practice sanitary measures such as hand washing. We have water in every point, such as the supermarkets and the hospitals when people walk in to be able to practice hand washing. However, regarding the issue that is really dire at hand is what I was talking about, the fact that girls are not able to access sanitary towels because in this particular region, they receive sanitary towels from the schools. And now that the schools are closed, you find that they are not able to access it because most of the parents are unable to purchase them for them and see sanitary towels actually as luxury items. So you find that indeed they are trading sex for sanitary towels, leading to a lot of the emotional impact, which is there's a lot of anxiety in the girls and also even in children, because some of them are obviously they're not going to school. They cannot be able to access online learning. They can, because of lack of electricity, connectivity issues. Yeah, so those are some of the issues that are happening.
And Terry, before I let you go, female genital mutilation, has that spiked in Turkana this time?
Not really. Female genital to answer the question.
Has this spiked in Turkana, the cases of the same?
The what?
Have cases of FGM spiked in Turkana County at this time?
No, FGM has not spiked in Turkana County. We're just having issues on child marriage mostly.
Early marriages.
Yes.
And what can you attribute this to? Is it because of a closure of schools?
It's actually because of the economic stress on families. Most of them have lost their jobs, at least those ones in informal sectors. And so in order to make ends meet, they would rather, sell off their girls, for some money. Yes. So I attribute it more so to that.
All right, even as we let you go, what would you put out there for the government and other stakeholders to ensure we safeguard their children?
I'd say that we must commit to end child rights violation, because that is basically what is happening. So I'd call on to the government to just put this in place and also focus more on the marginalized areas. So even as we have, we know that the schools are closed, but what more can we do for the children in marginalized areas to also continue with learning? And also just see how also they can be able to access some of these basic services that are there. And for us as agencies, we continue with our awareness raising campaigns just to be able to protect our children even more and do the best that we can for them.
Thank you, Terry Maloba, Senior Women Protection and Empowerment Officer at the International Rescue Committee in Turkana, Lodwar. Thank you for joining us and contributing to this virtual conversation. I'll cross over to Martha. Now, just talking to Terry, clearly the marginalized areas are areas we need to look into. Do you ever get distress calls from marginalized areas?
Yes, we do. We receive calls from all over the country, and some of them from very remote areas you wouldn't expect, really. And that also means that the penetration, the mobile technology penetration in Kenya is really good, and that is why also the helpline is so important, because with that kind of penetration, then at least the child on the ground in very far away places is able to still speak to someone through the gadgets that they have access to. Yes, and we have all those issues they're talking about of child marriages and children not being able to access education, but they have phones, even if they are the mulika mwizis, they're at least able to call the helpline to be able to raise their concerns and to talk to someone to help them with their anxiety and other issues as well.
Okay, now back to Nancy. We've said poverty is a #1 factor in as far as speaking to child rights infringement. Are we also looking at the health, access to the same? Has that changed during this season?
Okay, while speaking on health, the focus has been on hygiene, and the focus has been on hygiene, and focus has been on the COVID-19, not on other aspects of health. I think there has been some reductions, or people have a bit slowed down. And here we are speaking about children. Here we are speaking about the girls who need to access this, the sexual reproductive health services, who need to access the family planning, who need to access just some of the talks, because ideally as organizations we didn't see this coming, and we have been bandwagoning on children, girls coming together, children coming together on issues of mentorship. This has since stopped, and again for issues of social distancing, the community health workers are not able to do really their door-to-door services that they have been doing before. So for me, and I will say that as an organization, Plan International, what we've been trying to thrive on is now a youth platform, online platform, where the youths are able to share their issues of health, they are able to share their issues that are affecting them, because so that we are able to refer and we are able to link. Because it has been a bit difficult for them to access the health centers because of the change of focus.
Now, Kennedy, how does it look like in the informal settlements when it comes to access to healthcare now that the priority is food?
Say again, sorry, Gladys.
I'm asking, how does it look like in the informal sector, or rather settlements right now, seeing that everyone is focusing on food?
Yes. So right now, in the informal settlement, people are really just is all about food. But we shouldn't make a mistake of forgetting the health, you know, of the young girls at the same time. So it become really difficult and challenging, because when you are so much scared of dying from starvation than corona, that's an issue. So what we need to do is that we need also to promote, more of the health, because right now food has been a very, very big issue in the slums, as you said. You know, everywhere I go is all about food. Yeah. But doesn't mean that we have to forget other basic initial things that like health. So it's something that Shofco is working on. You know, we have health clinics in the slums that are still providing basic health for the girls in the community.
Now, there was information that most people countrywide are staying away from hospitals because they're afraid they would contract the condition or the disease in hospitals. Do we have community messaging to ensure or reassure those in the informal settlements that they can still go to these facilities?
Yes, thank you. What I can really tell you is that the government, through the Ministry of Health and the community health workers, have really started a very big campaign in the slums. You know what I mean? That is very powerful. They are going door to door, and that messaging is really working. As you hear before, right now, people are scared in terms of just think about your husband or your child taken away, going to a place called Baghdad. You have no idea. And then you have heard about the myths in China where people disappear. Not true, but myths. You know what I mean? So for them to counter that is when people are able to come to the community health workers, talking to the community on the ground, and to make them understand. And it's having a lot of positive impact on that. Another thing is this idea that you just walk the hospital, you get a disease, you don't get corona. It's not true, you know what I mean? I know there's high chances for that, but it has made people, even people just to be so much scared. So that also being done by the government to ensure that when you really kind of sick, really sick, you can still go to the clinic. There used to be a lot of rumors about it.
Okay. And when we think about the expectant mothers, are they going to have their children in hospital?
Gladys, to be honest with you, there is a big challenge on that. Even after pregnancy and having a baby, you know very well that talk about child and babies, you know what we call the vaccinations. If I'm honest with you, after corona, we're going to have a lot of cases. Even right now, I've seen cases whereby pregnant women prefer to have midwife in the slum than going to the hospital. So there's a lot of rates going to happen. The children are going to die, mothers. So we're going to see a lot of cases. And I feel like now we are not documenting them because we are focusing on corona. But believe me, after this, children who are supposed to get polio vaccine, measles, all these things, they are not getting it. I'll be honest with you. Because of that, you know what I mean? Because of that fear. So I think it's something that I've talked about children, it's something that, and babies, something that we should start thinking of as a government and see how we can solve that. Do we have door-to-door vaccinations, you know what I mean, for our children? Because it's a challenge, Gladys.
Okay. Now, speaking of expectant mothers, an expectant mother was among patients undergoing treatment at the infectious disease unit of the Kenyatta National Hospital. Though she has since been discharged, doctors had indicated that both mother and child were doing well, but warned she needed further attention to secure her well-being and that of her child, owing to the emotional toll the virus had on her. Now, Leila Mohammed looks at how in the age of this deadly virus, new life hangs in the balance and explores the measures taken to protect expectant and young mothers and the children.
An exclusive peek into the frontline in the war against COVID-19 brings home the reality of a disease that has the world in its grips. In one of the cubicles here, Nation journalists who were granted rare access into the isolation facility caring for COVID-19 patients could only quickly wave at a young, expectant lady. She waves back and slips back into her world. She's careful and stable, but her doctor can only see her from the door. They are hopeful that she'll make a full recovery. In Nairobi's sprawling Mukuru Kwenjenga slum, Florence Wambua is making French fries for lunch when we visit. She admits that this is one of the few cravings she has been unable to shake off since she became pregnant. And while she could have easily bought the fries from a local food vendor, she prefers to make them herself to avoid endangering herself and her baby.
Hata kutembea sahi, hata ukitaka kuendea mboga ni shida. Itabidi unakaa tu kwa nyumba.
For many women like her, the monthly checkups at her local medical center are key, but they have to be planned with precision. The night curfews and transport challenges occasioned by the restrictions on movement have compounded her woes.
Mtu anaweza shikika anytime. Yani anaweza ngojeka usiku. Sasa nilikuwa nauliza kama maaskari wanaweza umukienda usiku wasaidia hapa kwa barabara njuu saa hiyo ujui utapatana na maaskari wako aje.
For Mutheu Mutuku, who is admitted at the Makueni Mother and Child Hospital, the realities of the current night curfew hit home when labor pains struck 4 days ago.
Ilikuja nikiwa nyumbani around 4. Sasa ikakuwa siwezi ita mtu wa taxi juu ya hiyo curfew. Sasa tulimuita akatuambia tugoje mpaka 5. So we had to wait mpaka 5.
Here at this one-of-a-kind unit based outside of Nairobi County, the county management team in charge of health says they have ensured that movement in and out of the facility is restricted to key personnel and few family who come in to visit the mothers. While all who come in are required to wash their hands and sanitize their shoes and take a temperature test before gaining entry into the wards, wearing of masks is only left to the adults here.
We don't give masks to our babies, and that would maybe compromise their breathing mechanisms because they are small. So what we usually do is, because they are usually born in the unit, all the mothers have masks, and the service care providers, or those that are coming in contact with them.
The hospital administrators say that while a huge percentage of the mothers here delivered at the facility, they are now receiving an equally significant number of referral cases from hospitals within the region.
Nilianza kuumwa jana asubuhi, nikazidiwa jioni, nikaenda hospitali nyingine private Kikoko, nikazidiwa hapo, nikapewa referral letter.
Like now we have only 5 mothers who have delivered normally, spontaneous vertex delivery, and about 13 who have gone through cesarean section. And we have been able to really space them more than a meter so that they are safe.
In Bungoma, Wilfrida Mganda has had a hard time keeping up with her baby. Young Daniela is just learning how to crawl. She has also been weaned off milk and now has to be fed on a balanced diet.
Imelazimika mtoto wangu ameanza kunywa uji wa mahindi juu ile wakati nilikuwa naenda supermarket kutafutia unga, sasa sina hiyo uwezo.
She knows hygiene is key during this difficult time. While she has access to water, she says she cannot afford hand sanitizers.
Mimi kupata maji si shida, lakini hiyo sabuni hiyo sanitizer yenyewe ndio ngumu.
Her experiences and challenges as a mother away from major cities are not so different from those mothers living in slum areas in towns like Nairobi.
Niko na mtoto mdogo na kila mara ni kusanitize. Sasa zingine unapata nimesahau juu ya kusanitize. Alafu ile kupata pesa kununua sabuni pia unapata ni hiyo kunini ni ngumu.
Those who delivered and needed to go for checkups say that their clinic visits to public hospitals have considerably changed.
Ausgali wangu alikuwa aende anibebe mtoto, lakini kwa hospitali hawakubali uingie na mtoto na mtu yeyote. So ni mimi na mtoto tu tulipimo hiyo joto tukaruhusiwa kuingia na sina ile nguvu ya kubeba mtoto.
That is a reality for many mothers across the country. We are now joined by Selina Nkoile, who is a girls' rights activist from Narok County. Thank you for joining us, even as we talk about women and children and how their rights are actually intertwined when it comes to going to hospital. How does it look like in Narok, Selina?
Come again, please, Gladys.
When it comes to Narok, are women and children accessing hospitals?
Not really, because personally, I come from a very remote village, so the only health facility we have is a dispensary, and for us to access bigger hospitals with better facilities, we have to travel all the way to Narok, and mind you, we're in Kajiado County, which makes accessing healthcare quite a challenge, because then you have to rush against time, the curfew is there, you don't want to be found on the road, and then again it's far. So yes, we are having problems accessing hospitals.
Okay, and for the girls, we were talking about the different challenges they're dealing with when it comes to sanitary hygiene. How does that look like for girls in Narok?
Oh, it's a big challenge. I personally am having problems with that, because I have young girls flocking into our home every day asking me for sanitary towels. So there is a big problem with menstrual hygiene, and girls are not accessing sanitary towels or hygiene parts that they need. And it's even making some of them get in trouble, like get pregnant, because sometimes young men take advantage of this girl's vulnerability, and they lure them into having like affairs, so that they give them money to even get that essential needs like sanitary towels. So yes, there is a huge gap.
And maybe you can tell us, has the reality of COVID-19 hit home in Narok County?
Sorry?
Has the reality of COVID-19 hit home in Narok County?
In Narok County, like from a village setting where I am, it's really like the community is in total darkness. They're living another reality, because as you see now, all the interactions have shifted online, and in a community where half, like, or 3/4 of the population is not educated and they cannot access the internet, then they don't have access to a lot of information in regards to COVID-19 and how they can protect themselves and their loved ones from getting it. So people don't even have access to drinking water, leave alone water for washing hands and sanitizer. So really, people out here are in the darkness, but the local leaders and us, the young people, the youth leaders, we are trying our best to talk to people, create awareness, but a lot of people are still being left behind.
Okay, and definitely that speaks to the importance of having this conversation, as that now speaks to the rights of the children being infringed, as people do not understand some of the things happening around them. And when we come back, we talk more to other stakeholders who are involved in child protection, and we also hear from you even as you send your comments in. We'll be right back.
Hi, my name is Eliud Kipchoge. I would like to take this opportunity to wish all my fellow Kenyans peace and safety during these difficult times as we fight the coronavirus pandemic. Please follow the instructions given by our President, His Excellency Uhuru Kenyatta, and the Ministry of Health as we fight this pandemic. 1. Wash your hands thoroughly with soap and running water, or use sanitizers where necessary. 2. Keep your environment clean. 3. Stay at home and avoid unnecessary movement. 4. Take the necessary precautions to keep yourself and your family safe. Lastly, to my fellow athletes, please train in isolation and take necessary precautions. We shall overcome this pandemic. May God bless you and God bless Kenya.
The woman who stole his love from me, the one who took the man of my life from me, Grandma, is my very own sister. I'm returning your husband to you completely. I love him more than my own life, and that is why precisely what I want most is for him to be happy.
You never wanted my granddaughter in your son's life. If you accepted their relationship, it was only because I threatened you.
Neither your excessive makeup nor your provocative clothes help you to be special.
I said you're still the same woman without a heart and soul, without scruples.
I'm not going to let you insult me.
I'm not actually insulting you. I'm just accurately describing you.
The three sides of Anna. This is the time to make sure every table in Kenya has food on it. Dial *126# to transfer your bonga points now so they can buy food and necessities at any outlet with a Lipa na M-Pesa till.
Safaricom is for you.
You spoke, we listened, and now every weekday at 6:30 a.m. you can join Evelyn and Peter to get your daily fitness fix. Some body exercises and some dancing, while at each you could even lose some weight. Get moving, we guarantee you will love it. Good morning and thank you for staying with Your World. My name is Gladys Gachanja. Our conversation today is the child's rights and child protection. I have a number of stakeholders who actually look out for the welfare of children still speaking to us on the same, and you too can be part of this conversation even as you tell us how you are safeguarding the rights of the children wherever you are. How are you protecting them, especially during the season of COVID-19? And we have a couple of your feedback coming through. If we can look at that. Neymano Cheng says, why we need more of these programs? Thank you, NTV Kenya. We should rope in the government, especially the Ministry of Education, to discuss about the plight of children. The government's free sanitary pads program is needed now in the homes more than ever. Very valid point, even as put across by various speakers. Neymano Cheng again says advocacy on risks that children face and what the law says about child abuse in such times, highlighting cases of abuse, hosting police department, Department of Children's Services and CSOs working for children will to an extent reduce such incidences. Very well said, Neymano Cheng. Benedict Kimeunzia says enlightening them to observe all the government's directives and stay safe. They are of great importance than anything else. Yes, they are our little humans and they matter. Spencer Marcy, we enlighten them on hygiene practices to curb the pandemic. Very crucial because they say mtoto mleavyo ndivyo akuavyo. Moses Mutai says, I really love workouts, especially in the morning. I'm a martial artist and they are essential. Very good. This is essential in keeping and boosting your immune system. Kennedy Shirugu, good morning. Thanks for your good work, NTV. We appreciate your support and watching us on Your World this morning. Mama Afrik Bange says, at Kennedy Odede, doing a great job right there, giving hope to the hopeless. Big up to Kennedy, who's joining us, and he's the CEO of Shofco. Stella Simiyu, girls are vulnerable to sexual exploitation. It can be as simple as accessing bathrooms or showers where such services are commercialized, as is the case in most informal settlements. Yes, this is a reality for many living in the informal settlements. Arango Mandela says the government should consider its people first and those who are displaced because calamities and those who are extremely having hard times because of lack of jobs. They cannot feed their own families. Hii issue ya food ingekuwa serious nayo. All right, we hear you, Arango, and definitely something that has been touched on by Kennedy. Odede, Kennedy, a lot has been brought up, and of course, the vulnerability of those who are in the informal settlements. When we talk about our children there is something else that we need to look into. And before I get to you, in November of 2019, President Uhuru Kenyatta instructed all government officials, those from the Ministry of Gender and Youth Affairs, as well as administrative officers, to collaborate in ensuring that female genital mutilation is eradicated. Now, religious and cultural elders from 22 communities known for the practice joined the president in committing to stop the practice by 2022.
Eliminate female genital mutilation by 2022. In addition, the country will eliminate all forms of gender-based violence and harmful practices by 2030.
Selena, let me bring you into this conversation. FGM, you are an anti-FGM activist. You run a girls' rescue center. They are back at home. What does that mean when it comes to the spike of FGM in the family? We seem to have lost her audio, but let me speak to Kennedy. Kennedy, FGM is a reality, and the closure of schools puts many girls at risk. How does this look like in the informal settlements?
Thanks so much. I'm just so proud of what Selena she's doing in Narok, as you can tell, in that county. So what I did something interesting. I have a girls' school in Kibera in Mathare, primary school. So we took our girls to Narok, to go and talk to the girls in Narok. It was very interesting, and to see what's happening there. And in Road is that before, a couple of years ago, you remember people like Selena could be hiding. They couldn't talk about it. Governors, MPs, people were not talking about it, politicians. And the government has done a very big campaign, truth be told here, whereby even chief in a Narok can talk up against FGM. So I feel like as a country, we have made a big progress, although much needs to be done. And it's I don't want to say anything because Kibera is different from the village. So in Kibera, mostly you cannot really hide to do those, and it become it's a different challenge. So I see that in Islam, we don't face that much. Okay. Although I know some community try to do it, but not in a high number. But just to add what President Uhuru Kenyatta said is that we have, in the globally, I think there's a lot of things that have been done. I remember there was a time that every politician from Narok, from Rift Valley, people were really scared on talking about it. So as a country, we have made a huge step. And right now, we just need to follow the rules. We are, on paper, those things are there, and we can we are ahead of many countries in Africa. So I think we are heading towards the right direction, and we still need to do more.
Okay, and when we talk about doing more, Nancy, during the COVID-19 pandemic, we seem to be eating away at those gains. How can we ensure we don't do that?
Okay, I think the COVID-19, the New World Order has come up with different focus. And for me, protection of children or protection of girls, it is now not only meant for organizations, not only meant for the government, but again now it is an activity that should be done by everyone. Everybody should take up their role, because as an organization, our niche, or what we really do a lot, is ensuring that girls and all children are protected. But again, as we see now, where do children get information? Media and even parents, because those are the people that they are now close to. So it is about what it is that happens in the social media. Are we able to ensure that there is online safety? Because what do they use for learning? It is about social media. So me as an ordinary citizen, what do I ensure? I need to ensure that whatever I am posting on social media is something that is going to, not to scare the children, but ensure that children are protected. And even while speaking on the media, how do they package their information? How do they ensure that the information is palatable to the children? And again, have media even tried to edit their content now that the children stay longer? Some of them, earlier on there were some programs that maybe at 10 they will come at 10, but now you realize some children will even be sleeping at 11. So what is happening?
What is the importance of empowering the child in as far as ensuring their rights are not infringed is concerned?
For me, empowering the child will enhance reporting, because taking in consideration that the justice system, the referral pathway is not so much responsive now. Why? Because you realize that when you look at even the police sector, a lot of deployment has been done. You go to gender desk and at times you get somebody, at times you do not get. The courts are closed. So what does that one mean for us? That one means that at least there is some breakage in the justice chain. So for me, it is empowering the girls so that they are able to report. Are they able to access or even call the toll-free lines? Are they able to identify somebody that is near them, somebody that they trust, and able to tell them that this is what I am going through? And then what we are doing right now as Plan International is only just giving information, but also giving information where can children get help in case you are abused. Where are you supposed to go to, or who are you supposed to go to? And a lot of negotiations that we are working, we are trying to thrive on our earlier connections or our earlier partnership that we have had with different government departments. And as an organization, we are in a consortium that we are working together with other organizations, which we call Joining Forces Alliance. So in this Joining Forces Alliance, we are looking at the strength of each and every organization, and we are able to see who is able to respond on what. But again, we have continued empowering the children. Just what I told you about having our platforms, having our messaging, the telemessaging, the bulk SMS, just to ensure that the children are able to get the correct information, the children are able to report. So maybe when normalcy regains, we are able to follow up the cases. They are able to access the toll-free lines, they are able to call, and they're able to know that what is it that is happening to me. And even the children realizing that this one is an abuse, because most of the time things happen, and then the children does not even realize that, is this one abuse or not?
Okay, and Selena, when we're still talking about FGM, you run a child rescue center where girls run to when they are facing FGM or early marriages. Has that spiked during this season of COVID-19?
So, Gladys, we have one institution that's girls focused, and that's the institution that I went to, and that is basically the only institution and a boarding school in the whole world. And it's over 500 kilometer in an over 500 kilometer radius area. And unfortunately, with the COVID-19 situation and the directive of the government to close down schools, that center had to close down, and it was the only safe house or a safe place that girls were running into in the case of FGM and child marriage, and to even look for access to education. So right now that center, Naningoi, having closed down, every girl is back at home, and even girls who have been in the facility for over 4 years getting refuge, they all had to go back home just because they couldn't stay in the center, because the school basically didn't have time to put everything together so that they can contain the situation. So that is a huge blow for girls in my community, and it's going to impact them negatively, because even child marriage and teenage pregnancy is on the rise during this moment when everybody is home. So it has really, it's really impacting negatively on girls.
Okay, and from your experience, what can be done in this season to ensure that we safeguard the gains we made in as far as putting a stop to some of these retrogressive practices?
From my work and from what we do, we really think that the first thing towards achieving this is by the government making sure that there is good reporting mechanisms, because we are in a very remote area which is very hard to reach. So by the time there is an incident and we are reporting and action is being taken, we find out that the damage is already made and the rights of the child have been violated, and sometimes it gets even to serious, whereby we get a girl, she has been already married off and abused, and so the government can also make sure that they are implementing these good policies that we have all the way to the grassroots level, because Kenya has a lot of good policies that protect girls and women, but most of them are not really being implemented, and that's why we are always having these issues, and we can only achieve it if they're implemented. Because, for instance, we don't even have a police station in my community, so there is nowhere to report such cases, and it takes so long for action to be taken just because of our strategic location. So if everybody, like the government, the development partners, individuals, if they can all become actively responsible and just play their own parts, then these things will come to an end.
Very well said. That was Selina Nkoile, girls' rights activist from Narok County. Thank you for joining us. And we now cross over to Eldoret, where we meet Sally Kim, who works for Tumaini Education Center, where they rescue street boys, bring them to their center and rehabilitate them. Now, with girls being more complex, the organization leans on only rescuing the boys. The center was initially designed to primarily cater for boys, but with COVID-19 affecting both the genders, it puts them in a tight place.
My name is Ali Kimani. I'm the program coordinator here in Tumaini Innovation Center, where it's a community-based organization where we work with street-connected youth and children. Through rehabilitation, we rescue, rehabilitate, give training in vocational skills in mechanics, welding, hairdressing, catering, and mechanics. Before the COVID-19, we had 35 students who were taking the courses. Due to the COVID-19 and the lockdown in different areas and the measures that have been taken, we have been forced to readjust some of our programs, because our program is 1 year. And during that 1 year, we get to do a lot of rehabilitation, group counseling, individual counseling, life skill classes, and training. So you find that the children from the street, of course, they are under the influence of drugs and other substances. Some of them, there are those who are not. But you find right now, our program has shifted from 1 year to 3 days at most. And within those 3 days, you cannot rehabilitate someone from drugs. On the street, when you meet a girl on the street, there are so many challenges that they face. However, bringing them to Tumaini is now where the challenge is, because we cannot have both boys and girls in the same space. So it's not that we do not rescue the girls. It's that for the rescuing for the girls is a bit technical, because for them you have to rescue them immediately from the street and take them back to their family. While for the boys, they can come and stay here because for the 3 days, because Tumaini's infrastructure has been built for the boys. As you can see, we have even a dome that we are constructing to have more space for the boys. Once the project is done, our next project was to work on building a dome for the girls. However, for the dorms for the girls, it has to be a complex dorm that also comes with a daycare space, because most of the girls, teen mothers, are mothers on the street. So when you're rescuing a girl, you also have to factor in the child that she's coming with. We also have, of course, there are challenges like healthcare, sanitation for the girls that we need to consider before bringing in the girls here. I feel like they're a bit neglected, because, like I said, for the girls it's a bit sensitive. It's a sensitive matter, and having only infrastructure for the boys, because Tumaini previously was just working with the boys, has in a way forced us to start thinking about what do we do for the girls.
Ukienda kwa hiyo goma, unakaa hiyo goma kama Obama, ukiwa rada. Ukiambiwa uoshe vyombo, si ati unaanza kuweka watu mangumi. Unasema tu haya sawa, ni corona ishe. Acha tu niwashe corona ifanye nini? Ishe. Lakini unakaa ukiwa rada ndio usianze kukosana na huyo baba wa kambo juu. Baba wa kambo akikosana na wewe, ataambia mamako yeye aende ama uba.
My name is Sarah Muindi. We are equipping them with the skills they need to cope once they go home, so that they don't go home and are struggling to reintegrate with their families and are then running back to the streets again.
Naitwa Joseph Mohamed. Nimetoka Mkuru kwa Jenga. Sasa nimebidi kubadilisha tabia. Alafu nikakuja tu hapa. Sasa corona ikiisha naweza rudi home. Na tuko na hapa mandugu wangu mnawaona.
Ni nini mimi nataka? Hata kama ni hiyo pressure ndio tunaongelea.
A great initiative there, even as we take care of the boys. And there are those, I see your comments saying, why are we not talking about the boy child? But when we talk about children's rights, we're talking about all the children, Nancy?
Yeah, while speaking about child rights, child protection, it is about all children. So even us as an organization, while speaking or implementing protection, we also consider matters boys. And for what I will say that we anchor our implementation on the principles of the rights of the children, ensuring the best interests of the child are met. It is non-discrimination, meaning all boys and all children are included. And even while doing our activities, we consider the matters inclusion, both boys and girls. And then when we talk about perpetration most of the time, who are the potential perpetrators? They are always boys. So what we always do is ensure that as we are doing our awareness creation, the boys are involved, the girls are involved, so that they are also aware. Because at times you'll be able to do something thinking you're just empowering the girls, and the boys are not aware. They don't know what to do. And as an organization, we even have the Male Champions Movement. That is one of the groups that we have, that we have men that are championing for the rights of girls, for the rights of boys. And even boys in the schools we are working in, they're easily able to spell out their role in protecting the girls. Because you see Gladys there before, you will realize that if some man wanted a girl, they'll easily send a boy with a letter, send a boy to call for me that girl. But right now, the boys we are working with, they know that whatever I'm doing, I need to protect this child. And they're also even able to report on issues of the girl. They see a girl has been perpetrated. They see a girl that is in dire need of care and support. And the boys are able to support. So for us, we work with both boys and girls.
Kennedy, how important is it to actually enable and empower the boy child?
So Gladys, I didn't hear you well. Sorry.
How important is it to also enable the boy child when it comes to their rights?
I'm sorry, I feel like now the volume has gone really far away from me. Yeah.
Okay, we shall take care of that and be back to you in a moment. Martha, we talked about the girl child, and there are others who are saying, let's talk about the boy child. Do you ever get distress calls that have to do with the boys?
Yes, actually, majority of our callers are male, but sometimes they report on behalf of girls. So when you analyze data on violence against children, most of them are girls, but the reports are actually made mostly by the males.
That is an interesting scenario, considering the circumstances.
Yes, it is interesting. But then again, the place of the boy child seems to be a little more empowered than the girls. And they're also able to almost fend for themselves. So they're able to do certain things without feeling too restricted, including access to gadgets and reaching out for services, so to speak. But I am glad that they're also looking out for their sisters, and they're able to call on their behalf, knowing that sometimes these girls might not be able to speak for themselves. So that is a plus for us, and we need to continue creating awareness on the fact that child abuse is not normal, so that everybody has a responsibility to ensure that children are safe, whether they are boys or girls. We also need to make sure, therefore, that when a child is in need, they're able to access a service. It does not have to be 116. 116 is a brilliant service and is accessible. But how about a child who doesn't have access to a gadget? Can they access a police station, for example, or their teacher to call on their behalf or to report through the health centers if possible, or any responsible adult or other person who's able to present a case on their behalf? And meanwhile, when these cases are reported to us as the duty bearers and people who are offering various services, then it is also our responsibility to ensure that our response is not only of good quality, but it is also in good time, because it doesn't make sense that if you waste time and then you find you want to go to respond to a child who has perhaps already died. So effectiveness and efficiency is critical even for us as service providers in responding to the issues. So creation of awareness, optimized access, strengthened response is key to ensure that our children remain safe. So even as we encourage the girls and the boys to come out and speak about or speak against child protection, we need to also have things in place to facilitate them to be able to reach out and to receive the relevant services as well.
Now, after the break, we shall be joined by Sadia Hussein, who is an FGM survivor and, of course, anti-FGM activist from Tana River. And she'll be giving us telling us how the situation is in that region right after this break.
Basic protective measures as guided by the World Health Organization. Clean hands frequently with soap and clean water. Cover nose and mouth when coughing and sneezing with a tissue or flexed elbow. Avoid close contact 1 meter or 3 feet with anyone with cold or flu-like symptoms. If you have fever, cough and difficulty breathing, seek medical care early. Avoid raw or uncooked animal products. Help the world put an end to the spread of respiratory diseases by sharing this message with a friend. Message brought to you by Sour Herbal Family Bath Soap.
Working from home? No problem. Fiber Home has you covered with the fastest and most reliable internet speeds. Get connected today. Kazi lazima iendelee.
Was Agatha telling the truth, Andrea? That you were the one who pushed my mother down the stairs? How could you do such a thing? I'm sorry, I didn't mean to do it.
Where's my money?
Go figure it out.
I'm going to return your sister once I get my money back, okay?
What money?
The 800 million that was stolen from me.
I guess I'm the only one who believes in Agatha. I really hope I can find a way to help her. Can you hear me, Carrie? Carrie, you're awake! Doctor!
Thank you for staying with us. My name is Gladys Gachanja. Our conversation, children's rights and child protection. And we've asked you on the question of the day, how are you protecting your children or the children in your community during this season? What are you doing to protect your children or the children in your community during this season? Nancy Okoth says mental health is very critical during this period, and yes, even the children need to be looked out for. Dorothy Munyiri says, following, I have the same concerns. The issues of personal effects for the girls. Airtime is a big issue. They always ask for it and would even give their bodies for it. Nitumie credo, please, is what you keep being asked for. Yes, that rings true for many. Eunice Githogori, who says, sahi na hii maisha vile iko ngumu juu ya corona, ni vigumu kuwa protect, because many at times wako wanatafuta unga, huwezi jua vile wanashinda nyumbani. Well, Eunice, we hear you, and it's true. These are different times. Simon Amer, who says, watching from Kakuma refugee camp, wanting to get the latest update of corona threat, my dear fellow citizens. However, therefore, it's good to be in kindred spirits of showing ourselves to fight for corona together in the country. A very well said statement there, even as the children in the refugees matter. Now, Kasim Amar, who says, the things that some Kenyan girls in the rural areas have to go through, it really is sad. True. Another here from Korir Evans, who says, happy to see Martha, Childline officer. Good insights there. Thank you for watching, Korir. We have Odhiambo Charles, who says, happy to see Nancy Okoth. Kazi nzuri Nancy, somebody is watching. Namunyak Eneletura, who says, I'm watching from Narok, loving what Selena is doing. Say hello to her. We had her earlier, but thank you for watching. Philip Ocheche, my love for Shopko, our government should give them more. And the last one here, we have Kipkorir Rono. I think government should allow some public hospitals to help Kenyans. I hear you, and actually hospitals are they are functional. It's just that you are being encouraged to go to them, and you shall be protected from COVID-19. As I said, we're talking about children's rights and the protection of the children. We have Nancy Okoth, project manager for Girls Advocacy Alliance Plan International, in studio. Martha Sunde, executive director, Childline Kenya helpline, that is 116. She's in our other studio. Kennedy Odede, who is the founder and CEO of Shofco. Now we're joined by Sadia Hussein, who is a coordinator of Daya Women Group. We shall be joined by her virtually, and of course Jackson Onyando, who is the HIV and Child Protection Officer, UNICEF Kenya in the Kisumu Zonal Office. Thank you for joining us. And I'll start off with you, Kennedy, if you can hear me clearly now. We were talking about the importance of empowering the boy child during this season. How is this imperative, and how is it being done in the informal settlements?
What again, Gladys?
How important is it? Why is it important to empower the boy child, even as we look out for the children's rights?
Thank you so much. I think traditionally, boy child has been really more empowered. As a boy, you grow up, you just know you can play football, you have a right. And a girl child born, somehow you just say that you have no those rights. And I agree that there is a gap between boy child and girl child that needs to be filled. And what's happening now is that the boy child is crying. The boy child has been left out. And that's why we see a lot of crime in this informal settlement. Boy child is looking for mentorship. You know what I mean? And I hear many men complain about it. But it's a high time that how do we empower the boys to be the good partners, be good boyfriends, to be good fathers, to be good role models in the society? Because as we really try to fill the gap that has been left, whereby to educate our women, to empower our girls, we cannot forget the boy child. Because who are the perpetrators? The boy child. You know what I mean? So, and I really feel so sad when a boy child over age of 15 years old, 14, are being treated as an adult with this brutality on these boys. These boys are really so much stressed. You know what I mean? So I think as we're fighting for the gender rights, we have to start empowering the boys in a small way. I think for me, the best thing to start from, it will be in our churches or mosque, community Can we start mentorship? Can we start listening to the boys? Can we show them what is good to be a boy look like? You know what I mean? Being a man doesn't mean you have to be violent. You can also be a kind, soft man. You know what I mean? So that is, I think honestly, actually in Kenya here, in the slums, we need to do a lot of work to ensure that the boy child doesn't feel left out. Because they are fighting back. Look at the gang. Look at the shootings. Look at what's happening in the communities. It's the boys. Thank you.
All right, well said. Now, Nancy, there's a special group of people that we need to focus on, children living with disability. How do we protect them?
Okay, that is an area that I think that somehow has been left out, or not really left out. It comes with a lot of resources when you really have to, because when we speak about disability, there are different kinds of disability. So if you really have to respond to persons with hearing impairment, you have to put structures in place to respond to persons with hearing impairment. If you have to respond to people with physical disability, you have to adapt the environment to help them access. And in relating this even to the COVID, like right now you see all over there is hand washing stations. But again, you realize if somebody who does not have a hand comes in, how do they access that? How are they able to just ensure that they're able to wash their hands? We are having, because I see the government is already having the sign language interpreters, meaning that the people with hearing impairment are well taken care of. But again, as we are doing awareness, how are we ensuring that people with visual impairment are able to see all the posters that we've put all over? They are able to see that there is a hand washing station here, and I really need to get in here. So for me, disability, maybe so to speak, has been a bit expensive. And again, when we are speaking about, like right now, the COVID has come with issues of quarantine.
Yes.
And then our facilities were not adapted to support any people with special needs. So the people have been quarantined in a school which is not accessible in terms of there are no ramps in that school. But again, what do we do as at now? And it means that when we were doing our structures, when we were coming up with our frameworks, it means that it was structured with a lot of normalcy, or a lot of ensuring that people were with special needs were not considered. So for now, I think it is a high time, a call for action to implement our Bill of Rights, to ensure that persons with disability are also considered in everything that we are doing. Yes, it is not about physical only. It is not about hearing impairment. We have people with we have those with intellectual disabilities. And again, how do we ensure that we break down this message so that they are able to get it? Because they're not immune to corona. We have some of them that are walking in the streets. They're not immune to corona. So how are we ensuring that we protect them?
And the issue of children's rights and, of course, protection of the same is not only a preserve of Kenya. This is something that is being seen across the world in as far as violation of the rights of children. And doctors in India are battling to save the sight of a 7-year-old girl who was raped and then had her eyes damaged so she could not identify her attackers. Now, police arrested a 21-year-old man over the assault in the central state of Madhya Pradesh. The child was lured into an abandoned house while playing with friends and was found with her hands tied with severe injuries to her eyes. Martha, we've touched on the vulnerable group, that is those living with disability, and children fall in that bracket. When it comes to those distress calls, how many of those come from such a group?
There are also many, although many times they don't report on their own behalf for various reasons, but other people would call on their behalf. But there's a challenge in usually the response, because many people do not have the capacity to be able to handle children with such challenges. And so you find you have very few service providers nationally to whom you can refer such cases for action. And so you find before then the services reach to these children, it takes quite a while for you to lobby people, get to know who is doing what where in relation to that particular issue, and to be able to therefore avail the service to the child. Then we also have families who are very resistant to cooperate with authorities for the sake of these children, mostly because of the stigma that is associated with it. And so we need to continually create awareness in the community that as long as we have these children, and we will always have them in the society, there's nothing wrong with having these children. It's okay, and that they're just differently abled. And it comes with a lot of challenges raising them. Sometimes some of them you have to clean them up to the time they are more than adults, you know, and it's really a challenge. But we need to sensitize our communities that it is okay to have these children, and it is okay to seek help. It is okay to protect them. It is okay to be frustrated when you have these children, and so it is okay also to reach out for help, so to speak, so that people stop being silent about it, or assuming that since they are differently abled or challenged, as we call them, then we don't have to care for them at all. So we have seen various reports where we have seen children tied to trees, just so that they don't move around because they're disabled, so that their families can do other things to be able to raise them. We have seen some of them locked in dark rooms for years. Yeah, so we need to sensitize our communities to come out, talk about that situation, and seek help for the children and for themselves as carers of these children.
And to some good news from the coastal region, Mishi Kitsao, the new mother to quadruplets in Kilifi County, and her husband, Kombe Kazungu, were officially handed the keys to their new house by Governor Amason Kingi after NTV highlighted the plight of Mishi. Now, the lovely parents of now 7 children were blessed with 4 children about 1.5 months ago, and Governor Kingi committed to build a 3-roomed house after their 1-roomed house fell due to the ongoing rainfall. Now, the new house will ensure the family has a better roof to live under with regards to the current weather conditions and the corona pandemic. And Kingi also provided the family with essential products and promised to continue monitoring the children and engaging the family in a sustainable income generating business.
Amekuwa na sisi hapa kwa mwezi mmoja, na wakati wa yeye kuachiliwa kwenda nyumbani umefika. Lakini kile kizungumkuti ni kwamba mama huyu hana nyumba. Ana watoto tayari 2 kule alikotoka Kaloleni. Watoto hawa wanalala chini. Watoto hawa wanalala pamoja na mavea wake kule Kaloleni. Kwa hivyo nimejitolea kwamba tutamjengea nyumba japo ndogo, angalau ya room 2 na varanda, ili akitoka hapo hospitali awe anaweza kupeleka wale matoto katika mazingira ambayo anaweza kuwalea pasipo kuwaweka katika hatari ya kiafya.
A great initiative there and move by the county government of Kilifi. And Odede, just looking at that initiative, what more can our politicians or the government do to help those that are living under stressful conditions in this season? I think we cannot get Kennedy for now. Let me introduce Jackson Onyando, HIV and Child Protection Officer, UNICEF Kenya in the Kisumu Zonal Office. Thank you for joining us. And how does it look like for children, especially those who had to be sent home from the children's home? What are the challenges they're facing?
Good morning, Gladys, and good morning, the other panelists. Yes, the effects of COVID is becoming real for the children in the zone. UNICEF works here with up to 12 counties, and with the schools closed, I agree with most of the things that the panelists have said. We are seeing an upsurge in the cases of violence against children reported by us and also by our CSO partners and government. We are also seeing cases of increased cases of female genital mutilation in counties like Migori, especially the Kuria side. And for counties that have urban setups, we're also seeing an upsurge of cases around teenage pregnancies, especially because of transactional sex and lack of protection, especially when they're dealing with online gadgets or using internet. The other effect that we've seen is with the directive that were given by government, we also saw a number of children leave children's homes or charitable children institutions back to their families, without following the due protocol. So what is of concern to us is the situation of those children now in their alternative families that took them in. Because of lack of social gathering and community intelligence and surveillance systems, most of these cases actually don't get reported through the normal channels. And again, the perpetrators, knowing that it will take time, for even the justice system to work, somewhat doing some of this with impunity. So, because somebody knows if I defile a child, then it will take some time before the cases get reported. So those are some of the cases that we are seeing in the counties that we support here.
Jackson, you are a HIV and Child Protection Officer. When we talk about HIV, has the prevalence of that gone up during this time?
Sorry, Gladys, I didn't get.
When we talk about HIV, how does that impact the children, especially at this time?
Yeah, the areas that we support here are high HIV prevalent counties. Even before COVID, we knew that the population that we're talking about, adolescents and young people, gravely affected. So where we are talking about an increase in teenage pregnancy, when a pregnancy has occurred, it eventually means that the sexual intercourse was not protected, and then there are higher risks of HIV infection. As you know, most of the testing that we do now is at the facility because we cannot do community-based HIV testing because of the guidelines that have been given. So that means that access to HIV testing services is also reduced, especially for this population that was already vulnerable in terms of the friendliness of the services that are there. So we can already tell that with the increase in number of teenage pregnancies, what will follow, especially in the counties here, will be an increase in new HIV infections in this particular population.
And what is UNICEF doing to address some of these challenges?
So UNICEF works directly with government, national government. As you know, Children's Services is not devolved. Yes. So we're working with the Department of Children's Services, but we're also working with the county governments, especially the departments of gender and health, to create content. So you've seen some of the messages that is going out. UNICEF has supported government to provide adequate content for children that is now being passed through the community channels that we have, community health workers, through radio, through television. We are also involved in supporting the government technically in terms of improving the workforce. Even before COVID, the children's department was grossly understaffed. The closest you'll get a children's officer is at the sub-county level, or what were formerly the districts. And so we are working with governments to create a network of child protection volunteers who are coming from those communities and who can, apart from providing the messaging, can also pick up some of the cases for to be addressed in terms of case management. We are also lobbying for children's services to be included as an essential service. As you're aware, when the directives were given, the children's services weren't categorized as an essential service. So essentially, some of the children's service officers are actually working from home. So that tells you, if someone has a case to report, then they are not able to probably access a children's officer. So some of the things, those are some of the things that we're working on. And then lastly, we are also working with the Ministry of Health. We support both Children's Services and Ministry of Health. And Ministry of Health services are devolved. So we have sensitized the health workers on what needs to be done and the populations that need to be prioritized. And that population includes children and adolescents in terms of HIV testing. And for those who are already living with HIV, to ensure that their retention in care. So currently we are giving them up to 3 months of ARVs. So, to ensure that they don't fall back onto their adherence to treatment.
Thank you, Jackson Onyando, HIV and Child Protection Officer, UNICEF Kenya in the Kisumu Zonal Office. Thank you for your work, and we wish you safety during the season of COVID-19. And just to go further afield in as far as what is being done for those in the frontline, nurses, cashiers, nurses and doctors, just some of the portraits being projected on a giant screen in front of the Eiffel Tower as a tribute to those who have been mobilized during the coronavirus lockdown. Millions of people in France and Spain was set to embrace a relaxation of stay-at-home rules on Monday, but Britain extended its lockdown as countries plot their way tentatively through the coronavirus crisis. In France, people from Monday morning were able to walk outside without filling in a permit for the first time in nearly 8 weeks. Teachers will start to return to primary schools, and some shops, including hair salons, will reopen. Now, bars, restaurants, theaters and cinemas will, however, remain closed. Fears of a second wave of the pandemic, which has killed more than 280,000 people worldwide and wrecked the global economy, stalked much of Europe and the world, and with millions out of work and economies flatlining, including in the United States, where over 20 million people lost their jobs in April. Governments are desperate to reopen, but most are choosing a gradual approach. Well, it has been an incisive and very critical conversation, even as we spoke about child protection and child's rights. Make sure that you're doing your part in your community to safeguard our little humans. And thank you to all my guests who were able to join me on this conversation. Now, we were joined by Nancy Okoth, Project Manager for Child's Advocacy Alliance Plan International, Martha Sunda, who is an Executive Director at Childline Kenya Helpline 116, Kennedy Odede, founder and CEO of Shofco, and of course Jackson Onyando, HIV and Child Protection Officer. And we also had Selena in Kajiado, and also we had Terry in Lodwar. Now remember, we were also seeking your comments and feedback in as far as how you are catering for the children during this time. What are you doing in your community to protect the children? And a lot has been coming through, and one of them is from Sylvia Jacob, who said, that's so bad. How are people going to fight COVID-19 if there is not enough water? This matter should be looked at very fast. Another from Julie who says, why can't these children be removed from abusive homes? Are there no shelters for traumatized kids? Well, they are there, but we are looking at how that can continue going on even as we go through this season. Joseph Oluoj, I'm Joseph Oluoj from Mombasa. Keep it up. Kennedy Odede, of course, he's with us. Shofco is doing great in Mombasa. Free clean water, hand washing, and finally, Shofco Gender Desk in Bangladesh slum has helped many children get their rights. We only lack safe houses in that region. Okwama Mtoto wa Simba says, I'm tuned into the show and I'm enjoying the discussion. Thumbs up to Kennedy Odede of Shofco CEO. We are proud of his initiatives in the informal settlements. My team and I at Kishoko Youth Organization have found an effective and most accessible way to share information with such children and elderly people by the use of murals and graffiti paintings at village level in Likoni sub-county, Mombasa. Yes, we've been seeing that. We do draw murals with attractive pictures and words that are giving the appropriate messages about the COVID-19. Well done on the same, Okwamo. Now, we are bidding you farewell. Thank you for your company. My name is Gladys Gachanja. But before we leave, they say what a man can do, a woman can do better. Well, in this case, a girl can blast or bast moves like boys can. Enjoy some reggae juice with young battles of joy. See you tomorrow.
And if you're ready, make it.